Live. I am so excited that you're here. And today we're talking about fibromyalgia. And I'm going to say it right off the start. Here's what it is. I said it on TikTok. I'm going to give you the punchline right now. Fibromyalgia is not an acceptable diagnosis. That's the beginning, the middle, and the end. For many of you, fibromyalgia is something you get after years and years of running around from provider to provider. So you feel like it's the end result, but it's actually the beginning of the conversation. Let's dive deep and see what we're talking about. So fibromyalgia, for those of you who don't know, it's a diagnosis that people get when they have pain and tenderness all over their body, and it comes and goes. And usually patients also have other issues like sleep issues, memory, mood issues, overall fatigue. And they go around from doctor to doctor and appointment to appointment, and they're prodded and poked. And eventually they're told, hey, there's nothing wrong with you, so we think you have fibromyalgia. In fact, it takes an average of 2.3 years and almost 4 different types of providers to go to before you actually get this diagnosis. So you're running around, going from place to place, and ultimately you're given this diagnosis. And this diagnosis drives me insane because it basically means, hey, we know you don't feel good, but we don't know why. So we're going to give it a really fancy name. And here's the best part. We're also going to give you a whole bunch of medication, even though we don't really know what's wrong with you. Now, I'm not against medication, but come on, there has to be a better way, which is why I called it the new method, because you always knew there's a better way. You guys are super, super smart. So today we're going to talk about fibromyalgia. If you were told you have fibromyalgia, or you think you might have it, or know someone, and you've been down the conventional medicine road, we're going to talk about what it is, how conventional medicine treats it, but how we actually should treat it. If you type the word change anywhere, it lets my team know that you want a written copy of my crazy notes, so you can have that. If you're watching us on YouTube, don't forget to like and subscribe. And of course, for those of you listening on a podcast and you're not seeing my amazing hair today, I'm wearing a blue sweater and always the stethoscope that my wife gave me. And no matter what platform you're watching us on, don't forget to follow us on Instagram because we are funny. And share this with the people in your life who are struggling and let them become the game changers in their life. And for those of you who don't know me, my name is Efrat Lamandre. Everyone calls me E, and I invented the new method where we empower people to realize that their symptoms are not in their head. So join the conversation wherever you are. Let us know that you're here. And let's just dive into fibromyalgia. Before we begin, and I say this every week, no matter what topic I'm talking about, if you're feeling symptoms, if you're always in pain, if you're always tired, you must always, always start with conventional medicine. Don't skip that step. Never self-diagnose. I cannot stress this strongly enough. This is not an either or conversation. This is how we use both worlds in the best way possible. Go to the primary care, run the tests, get the referrals, go to the specialist, let them run their test. Let them tell you that nothing is wrong with you or that you have fibromyalgia. That's perfect. Then you're in the right place. But always make sure that nothing else is going on. Okay. I'm going to say that every week because I have to make sure you guys stay safe. Don't skip this step. So let's talk about the medical criteria of fibromyalgia. Like, how is it that your doctor, NPPA, how is it that they come up with this diagnosis? Where does it come from? So there's actually guidelines for it. And it's from, it's the latest guidelines. I took it from Up to Date if anyone wants that source, because someone on TikTok told me that I wasn't didn't know my guidelines. Incorrect, sir or ma'am. I 100% know my guidelines. So here are the guidelines for fibromyalgia. The main symptom of FM, fibromyalgia, I'm just going to say FM because it's a lot, is widespread pain, also termed multi-site pain. It's everywhere, but it doesn't end there. It's fatigue, sleep disturbances. Most patients with FM actually have what's called non-restorative sleep, meaning even if they sleep 8 to 10 hours, they do not wake up feeling refreshed. Cognitive disturbances is very common. People will call it fibrophobia. They just can't seem to get there, especially if there's rapid decisions that have to be made. They get really fatigued. They'll also describe psychiatric symptoms. Depression or anxiety is seen in about 30 to 50% of people who have fibromyalgia. Probably because it's so frustrating to have fibromyalgia and not get it answered, but we'll get there later. Paresthesias means your skin feels weird. Numbness, tingling, burning, creeping, crawling sensations, especially in the arms and the legs, is a classic sign of fibromyalgia. Headaches. Headaches is present for a lot of people with FM, migraine or tension type headaches. And then there's other symptoms of disorders that I kind of just thrown in there. Abdominal and chest wall pain, irritable bowel syndrome. You know how I feel about that one. If you don't, please go watch my episode. Pelvic pain, bladder interstitial cystitis, or something called painful bladder syndrome. So you mix all these in a pot, and then you say you have to have it for at least 3 months. And then you say nothing else could be wrong with you. And you get this fancy diagnosis of fibromyalgia. On physical exam, the exam tends to be really normal for that patient. Everything is fine, except they'll be really tender to palpation in several parts of their body. And as far as lab tests go or images go, there's nothing. Everything is going to be normal on the patient with FM. So there's nothing there. So the diagnosis is made if the patient has all these symptoms for at least 3 months with no identifiable cause. That diagnosis is made. So it rests on a list of symptoms and excluding all other conditions. It's called a diagnosis of exclusion. So you have to exclude everything else, and then you stamp it fibromyalgia. Congratulations. Now, here's the funny part. This is the treatment. You get the stamp, you're called that you have fibromyalgia, and here is the treatment. First is patient education. The guidelines say to give people an explanation that fibromyalgia is a real disease. There's like a whole paragraph on that. But we don't know the cause of it. We don't know the cure of it, and that your symptoms will come and go, and have a nice day. They also recommend exercise, aerobic exercise, which we'll talk about why that's a little problematic in a bit. They recommend antidepressants for the pain, and also nerve pain such as Lyrica or gabapentin, and of course, psychological therapies, because you're obviously a little bit crazy. That was sarcasm for someone who didn't catch it. So basically, you've been diagnosed with fibromyalgia. You've probably been told by your doctor that your condition is unknown. There's no treatment, and you'll need to rely on medication to manage your symptoms for the rest of your life. All this does, by getting the stamp, some people said to me on TikTok, you're disempowering people who have fibromyalgia. I'm not disempowering you. I'm empowering you to know that that is not where the conversation ends. There is so much more that we need to do, and we're going to talk about that. Because all this does, this fibromyalgia stamp, is it puts you in a box. It puts you in a box that actually takes away all hope, because we're telling you we don't know what causes it. We don't know how to fix it. Have a nice day. And let me let you in on a little secret. If you walk around to the next provider and tell him or her that you have fibromyalgia, they're already boxed you. That's a little bit crazy. I hate to say it, but that's the fact. So you're walking around, you're feeling great. I have this disease. I finally know what's wrong with me. But it puts you in a box. And when you go from provider and provider, that box is very hard to come out of. So I want this conversation to be empowering and to help you move past that diagnosis to actually get the results that you're looking for, which is to get rid of the pain and the fog and everything you're dealing with. Because in functional medicine, we know that when your body has symptoms, it's trying to tell you something. And just because we don't have the blood markers that call it a disease doesn't mean we're going to ignore it. And it certainly doesn't mean we're going to throw antidepressants at it. So we need to see what's actually causing this fibromyalgia. And each person's different. There is not one particular cause. So I'm going to give you a list of possibilities. The first is gut dysbiosis. If you've watched any of my lives, any of my episodes, you'll know that gut dysbiosis is where it's at. It's about your microbiome. Quick catch up. Your microbiome is the bacteria and fungus and yeast and viruses that all live in your belly, and they have to live in harmony. And if there is no harmony in your microbiome, there is not going to be harmony in your system. Your belly and your system are connected. So if you have the wrong kind of bacteria in your belly, it can produce certain substances that is going to cause nerve pain, brain fog, etc. Here's the clincher. Even if you don't have stomach issues, if you're like, my stomach's fine, I don't have bloating, I don't have anything going on, you still might have gut dysbiosis, because the gut dysbiosis means the bacteria is off, but the symptoms may not be in your belly. The symptoms, your gut bacteria might be off and your skin might be off. Your gut bacteria might be off and you have brain fog. Your gut bacteria might be off and you have joint pain. So just because your stomach feels fine doesn't mean you don't have gut dysbiosis. So that's the first thing to explore. Part of that gut dysbiosis is making sure you don't have SIBO, small intestinal bowel overgrowth, or leaky gut, because those two things need to be managed. I did a whole episode on those. Food sensitivities, huge player in fibromyalgia and feeling unwellness and I don't feel good-itis. Food sensitivities is not the same as allergies. Food allergies means I eat a banana, I get a hive, I have a histamine reaction, I need to take a Benadryl, an antihistamine. Food sensitivities means that when you eat something, you don't have an allergic response to it, but you have a systemic response to it. Your system responds to it. For example, certain foods might be triggering a headache. Certain foods might be triggering skin issues. Certain foods might be triggering heart palpitations or sweats. So even though you're not allergic to them on an allergy test, you might have food sensitivities that are causing some of the symptoms of fibromyalgia. Thyroid issues. Again, I did a whole thing on TSH. Here's the bottom line. Don't just check your TSH. Make sure you check all your antibodies because you could be cooking a thyroid issue for years and it feels like fibromyalgia. And if the only test you run is TSH, well, you're not going to find it. Nutrient deficiencies, low mag, low vitamin D, low B12 will all make you feel unwell. You need to get those in there. Adrenal fatigue. We did an episode on this also. Adrenal fatigue can feel like what fibromyalgia feels like. Non-restorative sleep, always tired, classically tired after exercise, never feeling rested. That could be a sign of adrenal fatigue. You need to test for that. Mold. You might be sensitive to mold, to mycotoxins. Toxic metals. You might be sensitive to mercury, lead that's in the environment. And I left last in there is mitochondrial issues. And I'm going to talk to you about that a little bit at length because it is so important for fibromyalgia. So hang tight for mitochondria. It's a long word. You learned about it in high school. Super important. This is the list of the things that can really be causing what fibromyalgia feels like. You could see just from this list, and by the way, it's not the entire list, that there are actual causes of why you're feeling like fibromyalgia. And if we can determine the cause, then we can get cracking with the solution. But none of these are things that conventional medicine tests for. So their tests are going to show you're fine, but these tests are going to find something. That's why you need to work with functional medicine. After you've worked with traditional medicine, you have to go and dig a little deeper. Because if you find what's wrong, we can help fix it. And by the way, fixing it does not involve antidepressants or nerve pain. Again, not telling you not to take it, just saying we're looking for a solution, not just pain relief. Before I continue on, I need to take a moment to talk about mitochondria and mitochondrial repair because it is so important for fibromyalgia, but honestly, for just about any disease you're dealing with. So quick recap for those of you who forgot biology class. Is it biology? Maybe. Yeah, biology class in high school. Mitochondria are these tiny little factories in your body that turn food and oxygen into energy. It's basically where metabolism happens. So they take the air you breathe, the food you eat, process it, and make it into energy. It's the gas for your car. If these little factories get affected, your whole system is going to be affected. Now, mitochondria are very sensitive to damage. That whole list I said above, the food sensitivities, the toxins, it's going to affect your mitochondria. So when these guys aren't working well, you're not working well. Fatigue, memory loss, pain, rapid aging, all of that we just talked about, that whole feeling of fibromyalgia is actually a mitochondrial issue. Fatigue is the most common symptom for people who have poorly functioning mitochondria. It's actually the reason why we age. It's actually the reason why we get tired as we age is because our mitochondria just can't keep up. So another quick science explanation is about free radicals because we hear about them all the time. But free radicals, and I did a talk on it. You can find me on TikTok. I explained it as well. So mitochondria, they burn and metabolize oxygen and food, right? They turn that into energy. When they do that, they have waste in the form of a free radical. Free radical just means it's a molecule with a single electron, and this single electron does not like to be single. So it is causing drama in your body. It goes around, this free radical, and says, I need an electron. I want to be paired up. And it steals an electron from anything around it. It steals that electron. It feels whole and great. But now that other molecule becomes a free radical. That one steals the next one, and so on and so on. This cascade of one molecule stealing an electron from the other is called oxidation, and it is a problem. It's what makes us sick. So we need a superhero. And the superhero is someone that could say, hey, free radical, I get it. You're looking for a partner. I'm going to give you a partner without it affecting me. And that superhero is called an antioxidant because it stops the oxidation process. So if you want to protect yourself from free radicals, you want to protect your mitochondria from free radicals, you have to give them antioxidants. Antioxidants are in your diet. We're going to talk about that. So when you eat these empty calories, sugar, flour, processed foods, all these things that we talk about, and you already know about insulin, you know everything else we've talked about, we actually never talked about that all this food that you're eating produces all these free radicals. And if you don't give them antioxidants found in fruits and vegetables and all the good food, you'll never be able to stop this cascade. So part of the fibromyalgia picture is fixing the mitochondria. So the goal of treatment, we talked about in fibromyalgia, all the things that could be causing it, right? So now we know how to treat it. If you have a gut issue, gut dysbiosis, we have to support the gut by fixing the bacteria and microbiome. If you have a food sensitivity, we have to discover it and eliminate it. If you have a nutrient deficiency, we have to fix it. If you have adrenal fatigue, we have to fix the adrenals with herbs, supplements, managing stress. If you have a thyroid issue cooking, there's herbs and supplements to help that along and to avoid triggers. If you're exposed to a toxic load, mercury or mold, we have to remediate that and help your liver detoxify. We have to understand that telling people to just exercise is not enough. Part of the treatment for fibromyalgia is understanding that exercise has to be gradual, graded exercise. You push somebody with fibromyalgia too fast, they're going to relapse and feel horrible, just like people with adrenal fatigue. And of course, on the list, now you understand they need to have mitochondrial repair. So you do all these things, you fix the gut, get rid of the toxic load, but you have to focus on the little guys that give you energy, which means you have to provide plenty of antioxidants in your diet to combat the free radicals in your little factories. So now when I talk about every week about minimizing your intake of processed food, junk food, sugar, empty calories, artificial sweeteners, and all that, another dimension is to understand why I tell you to eat the rainbow is because it's about eating the antioxidants that balance all these free radicals. I hope that by giving you another dimension of why we do these things, you can kind of connect with it and resonate with it. And there are also supplements that are really specific to mitochondria. So L-carnitine, ALA, alpha-lipoic acid, CoQ10, NAC, resveratrol, which I always pronounce wrong, magnesium, and omega-3. Again, never a cure-all, always part of this complete breakfast, but as part of a whole food, plant-based, it didn't say vegan, I said plant-based diet. If you don't know the difference, shoot me a message somewhere and I'll explain it. All these things together can help repair the mitochondria. And I spoke super fast because I wanted to get all this information in because I got really excited about this topic. And this was me minimizing the content. So as always, here's the bottom line. Let's do a quick recap because recapping is my favorite GIF or GIF. And if you don't know, type in the word recap in your Apple phone and you'll see my picture. Bottom line, fibromyalgia is not an acceptable diagnosis because it's actually the beginning of the conversation. You go to primary care, you get all the testing done. When it's all negative, you find a functional medicine provider or work with us, and you have to find what's actually causing you to feel so unwell. And I know this is a lot, But if you want to work with us, this is how. You find us at The New Method just about on every single platform except for Twitter because I talk too much. So at The New Method website, at The New Method Instagram, YouTube, Facebook, you name it, TikTok. Send us a message if you want to connect. But the bottom line, use this information to take your health to the next level, whether it's with us or someone else, to understand there is more to fibromyalgia than just accepting that diagnosis. I hope you become the game changer in your life because you always knew there was a better way. I will talk to you guys next week.